All right, we ready? Well, good afternoon. We hope everyone had a safe and healthy Labor Day weekend, and that getting back in the routine is that's hard to do after a long weekend, but it's got to be done. So we're glad to be back. Speaking of routine, we're here to bring you the information and update on our COVID situation. City Manager Zanoni is not going to be here today. He is on a conference call getting the latest updated information on the gas well out in the Gulf right offshore of Padre Island out near Bob Hall Pier. And from what information he gave us this morning during the City Council meeting, the repairs are underway, and the gas and condensate is about 5% of what it initially was when the valve blew out. But those repairs are currently being done now, and I think I recall him saying that they should be completed by this afternoon or in the morning. So be looking for some type of updated information, press release or something following their call at 5 o'clock today. So we're multitasking today at the city, and so we wanted to continue with this. Dr. Bird will be with us in a short while to give us some statistical information, and I'm hoping that the activities of the weekend will be a weekend remembered of fun and relaxation and not an increase in the number of cases. But I can tell you from the numbers that Ms. Rodriguez shared with me a little earlier, you're going to be pleased with the numbers that we have to report today. They're exciting, and so I'm going to let her tell you that. But we're making significant progress, but then some days we hit a little bump in the road, but I think we're on the right track and want everybody to continue to doing what they're doing in terms of their personal hygiene. I know you get tired of hearing that, but it's a fact of life. As a matter of fact, somebody in the medical profession was telling me the other day that it's going to be interesting to see with all our hygiene emphasis of washing your hands and the wearing of masks, to see what kind, and he thinks there's going to be a positive impact on just the regular flu season. So what we've been trying to teach for COVID may very well pay dividends through the regular normal routine flu season that we experience every year. So keep that in mind. So there may be some silver lining to all of this exercise that we've been going through for COVID. It may very well pay significant dividends under the normal regular flu season. So we're grateful for that. And I'll let Annette come up now and give you the statistics on the activities through the weekend and the numbers that we have today. But like I said, the numbers that she has, I'm very excited about them, most of them. Anytime there's a death, I'm not excited about that at all. But the number of cases is pretty exciting news. And we don't want to ever forget those that have lost their lives as a result of this pandemic, and we're trying to minimize that on a daily and hourly basis. So she'll finish with her presentation, and then Dr. Bird via WebEx or virtually will give us the information, and I hope he is recovering or recovered from, I guess he just had talked about COVID so much that he couldn't stand not getting it, but I think he's on his road to recovery from what I understand. So we're glad to hear that, Dr. Bird, and hopefully you'll be back amongst us here before too much longer. So, and the governor, I do understand, extended the declaration of emergency until October the 7th. And so we're going to continue to honor that. And I think our legal staff is probably drawing up orders so that ours will reflect what the governor has said. I don't think there's any significant change in that, but just an extension of the deadline till October the 7th. So another 30 days to kind of see where we are with these numbers. So with that, I'll turn it over to Annette and ask her to come up and give you the current information.
Espero haya pasado un buen fin de semana feriado, pero ya regresamos para darle una actualización sobre el coronavirus. El administrador de la ciudad no va a estar presente ya que está en una junta sobre la fuga de gas ocurrida la semana pasada. Esas reparaciones se espera terminen ya sea durante el resto de este día o para el día de mañana. Continuamos teniendo resultados buenos en cuanto al virus. Esa información la va a reportar la directora del Distrito de Salud Pública, Anet Rodríguez. Todas las medidas de salud que se han tomado para evitar el contagio del coronavirus van a ayudar para evitar casos de gripa. También le queremos informar que el gobernador del estado va a extender las previsiones hasta el 7 de octubre, así que tendremos también esa información legal de 30 días más sobre el estado de emergencia por parte del gobernador. Ahora la directora del Distrito de Salud Pública, Anet Rodríguez, nos va a dar su reporte en la ausencia de Peter Zanoni. Posteriormente tendremos el reporte de la Universidad Texas A&M.
Thank you. Annette Rodriguez, Public Health Director. I am going to start with the statistics today for our COVID-19 numbers. So on this slide, you're going to see that what the mayor was talking about is that the numbers for today, September the 8th, have dropped to 12 cases today, which is a really good thing. We've really needed these numbers to come down. And so if you look on the weekends, like the 29th and the 30th of August, they're normally lower than during the work week, so 40 and 33. But then this number here on Saturday was 92, so it's a little higher. And we also had some what we call a data dump. The state sent us some additional numbers on those days, and then we scatter them out to actually where they actually go. So if the test was done in July, we put that with the July numbers, so that way it can actually give you a better statistical number than if you just put it where they actually just sent it to us. And so these are the numbers today. Next slide. And with the state numbers, the data dump that I was talking about, the 119 from Saturday that we received, they go throughout the course of this slide here, and they even go further back. So if you added them up, it wouldn't add up to 119 because there's more, but they're further back all the way into June. And so you see those numbers there. But those are actually the numbers of people that took the lab test on those particular days and came back COVID positive on those days. The next slide. And so this one you see, it looks like a very normal bell curve, and you see our peak was right around July 15th, it looks like, and the numbers are coming down, which is very good. Again, that's what we're wanting, especially as we're going into seasonal flu, which starts October 1st. Next slide. And this is the donut diagram, which is looking really, really well because you see a lot of recovered. The recovered now, starting in August, we go by the formula. So it's 10 days of improvements. After 10 days of improvements and you're no longer having fever, you can be considered recovered to be able to go back out into the community. So we have 16,204 that have recovered. We do see that we have still 2,804 active cases, and then we also have the 381 individuals that have died, lost their lives to COVID-19. And again, our condolences do go out to the family members of all of those individuals that lost their lives. Next slide. Here are the hospitalized patients. And if you look, it's actually just a 2-week graph, and it goes from 175 to 109. So the hospitalization numbers continue to come down. So, and we want them to continue for people to get discharged, go home, completely recover. So we want the numbers to completely come down as well. Next slide. These are the individuals that are in the ICU. Some of these individuals require ventilation, mechanical ventilator to help them breathe. But if you see also from the beginning to here, you see a decrease in the number. So we do know that sometimes individuals in the ICU that have had to be put on the ventilator will pass away. So, but our hopes are that the people in the ICU are recovering and that they can actually get discharged home as well. Next slide. The total deaths, when you add in the 3 deaths today, is now at 381. And the last slide. So this gives you the 7-day average, and if you look, now the 7-day average is down to 35 per day, which has actually gone down very well. So thank you to the community for that. So I'm now going to switch over and talk to you about some public health concerns. So Labor Day weekend attracted many tourists, to different parts of the country. We saw that. But for the Coastal Bend, many people came to visit from out of town as well. If you celebrated with people, and many people were in attendance, whether it was here in Nueces County or somewhere else, public health is asking everyone to monitor their symptoms for the next 14 days. It's going to be very important. COVID-19 has an incubation period of 2 to 14 days, which means that if you were exposed to somebody with COVID-19, you could actually develop the signs and symptoms within these next 13, 14 days. So if you start experiencing signs and symptoms, please talk to your medical provider or call the health district. The phone bank at the 361-826-7200 to get an appointment in one of our drive-through clinics. For individuals who are already COVID-19 positive and they're in need of medical care, you can also contact the COVID-19 outpatient clinic. They're available to help you. It's free, and the number is 361-826-8019 to speak with a doctor. So today was also the first day for some students for back to face-to-face instructions. Public Health is asking all the parents of these students that had face-to-face today to actively monitor their students' health. We're encouraging families to develop a plan for when a student becomes sick. Also, you should have a plan if parents become sick, especially if it's with COVID, since household members, including their child, would have to stay out of school for the entire 14-day quarantine period. Therefore, it's important for everyone to continue to monitor their symptoms, and if they're sick, to stay home. Even if the family thinks that it's just allergies, just keep them at home, let them do class instruction through the Zoom mechanism. We have all heard it expressed that younger individuals do not experience as critical symptoms from COVID-19 than older individuals or individuals with comorbidities. However, this virus is novel, which means it has never been seen before. We do not have information regarding the long-term side effects of the disease. We have seen reports that indicate people who were infected months ago are still experiencing negative effects. The only way we will know what these long-term effects will be is what we learn over time. So what can we do? We can all do everything in our power to prevent getting sick by making sure we continue to follow our public health prevention tools. The first and the biggest is if you're able to stay home and not get exposed, then do that, stay home. But you can also wear a mask when out. You can also practice your social distancing yourself as far away from others as possible. You can also wash your hands often without making them raw. I've seen some people that they wash their hands so often that their hands are becoming raw. When that happens, you're actually more susceptible to pick up germs because your hands are now cut. So your intact skin actually helps you more than skin that's raw. So don't do that to yourself. In the next months, you will also be hearing a lot about seasonal flu and COVID-19. Both viruses have similar symptoms. Both can cause vulnerable populations to be hospitalized. Currently, we do not have a vaccine for COVID-19, but we do have a vaccine for seasonal flu. So please remember to get your vaccine. CDC recommends that everybody 6 months of age and older get vaccinated. Flu is typically transmitted at higher rates in homes, in schools, in daycares, and nursing homes, in businesses, and really anywhere where people spend a lot of time together. COVID-19 also spreads the same way in those same places. To prevent spreading of both the flu and COVID-19, all who are sick must stay home. When at home, precautions should also be taken to prevent spreading illnesses to household members. If possible, the person who is sick should be in a separate bedroom and use a separate bathroom. If separate rooms are not possible for the household member, Then shared space should be well ventilated by opening as many windows as possible. Commonly touched areas should be disinfected often. Household members should stay at least 6 feet away from the sick member. The sick person should eat in a separate area and avoid sharing personal items with other members of the household. The rest of the household members should wash their hands often, clean and disinfect commonly touched surfaces, and monitor their health closely. Get prepared for flu season. It's only a few weeks away, and always stay informed. Thank you.
El fin de semana del Día de Trabajo atrajo a muchos turistas de diferentes partes de nuestro país, por lo que el Departamento de Salud Pública le pide que monitoree su salud, especialmente durante los próximos 14 días. Si estuvo expuesto al virus durante este periodo, podría desarrollar signos y síntomas de infección. Si es así, habla el Departamento de Salud al número 826-7200. Para las personas que han resultado positivas y necesitan más información y orientación, puede llamar a la clínica al 826-8019 para hablar con un médico. Hoy muchos estudiantes regresaron a las aulas, por lo que los padres deben estar pendientes de la salud de sus hijos. Cuente con un plan en caso de que usted o sus hijos muestren síntomas de la enfermedad y si es así, mejor que sus hijos estén en casa. Médicos continúan aprendiendo más sobre este virus, el cual es nuevo y poco se sabe sobre los efectos secundarios. Esto los vamos a conocer a largo plazo, por lo que seguiremos recordándole que la mejor manera de evitar esos efectos es evitando la infección y siguiendo las pautas de salud, como es la utilización de cubrebocas, no tocarse la cara con las manos sucias, lavarse las manos seguido y practicar el distanciamiento social. También pronto comienza la época de gripe y ahora es cuando más se recomienda vacunarse para evitar enfermarse seriamente de la gripe, la cual se propaga de igual manera que el coronavirus y en los mismos lugares. Desinfecte todas las áreas tocadas con frecuencia y aísle a una persona enferma para evitar más contagios en su hogar. Ahora el doctor Chris Bird nos va a dar su reporte por parte de la Universidad Texas A&M.
Good afternoon, everybody. My name is Dr. Chris Bird. I'm here on behalf of the COVID Task Force for the Coastal Bend area. Just have to fix my screen here for a second. There we go. The task force objectives are twofold. One is to address your concerns and questions about COVID-19 and the interventions taking place to control the spread of COVID-19. And secondly, to enable evidence-based decision-making on behalf of our leaders. There are presently a few interventions that are in place. One is stay at home if you can. I know that it's been a long time that we've been under this directive, but that recommendation holds. Stay home if you can. Social distancing and face coverings are required. Self-isolate when you're symptomatic or when you're exposed to somebody who's tested positive for COVID-19. Like today, I'm still coughing from COVID-19, and so Public Health Director Rodriguez told me that even though it's been 14 days since I tested positive, that I should continue to self-isolate until the symptoms subside. 4, there's school restrictions in place where our schools are not going back to full in-person, face-to-face classes. There's a reduced number of students in the classes, both at universities and in our K through 12 schools, and we expect that that's going to continue. And we've been through a variety of different statewide intervention regimes, and then we went through an opening from Open Texas Phase 1, which started around May 1st, Open Texas Phase 2, to Open Texas Phase 3, which lasted for about a month, in which case on June 26th, Open Texas Phase 3 was repealed, and then a week later, Open Texas Phase 2 was partially rolled back, and the restrictions have been fairly consistent since that point in time. And so that's now been well over 2 months that we've been trying to get Open Texas Phase 3 and the fallout from that under control. So for our transmission rate, which is the number of people that are infected on average by other people that get COVID, it's between 0.9 and 1.0. This is a little bit lower than last week where it was up to 1.1. So it's a positive development. We are trending right around the 1.0 line. If you look at this graph back from the beginning of June to present. So it's important that we keep continuing to try to control the transmission of COVID-19 so that we don't experience another outbreak. If you look at this map of Texas, it's color-coded by the probability that the transmission rate is less than 1. This is important because when the transmission rate is less than 1, that means that COVID-19 will decline and eventually be extinguished. And so right now, over the whole state of Texas, the probability that R is less than 1 is either better than 50-50 or 50-50. And that's better than we've seen in the past few weeks. So hopefully this trend continues with us seeing more blue on this map. Again, blue is good, red is bad, white is kind of in between the two. It means COVID-19 will continue at the same level. Obviously, we've been in a decline, and so we think that the transmission rate has been just below 1. In terms of our rankings against the rest of the states, these rankings are for each trauma service area, which going back to here, each one of these sections of the map are a different trauma service area. You can see it goes all the way to trauma service area V, and we're trauma service area U, Coastal Bend right here. So we have the third most cases per day, per capita in the state in terms of all the trauma service areas. So again, we're hoping that these can decline further. Looking at our cumulative number of cases, I want to emphasize that these are the confirmed cases with the PCR test, not probable cases like are reported in the newspapers. We've pulled those out because the state of Texas DSHS website indicates that only confirmed cases should be reported in their databases, and so we use these numbers to compare to the rest of the state. And so there have been 22,240 total COVID-19 cases in the Coastal Bend area. Those are confirmed, with 19,590 recoveries. And there's presently about 2,139 active confirmed cases, not just probable. And this trend is going in the right direction, going down, so we hope that that will continue. And so this Texas-wide outbreak is receding slowly, but we're not out of the woods yet. In terms of the rest of the Coastal Bend, and I'll omit Nueces because Public Health Director Rodriguez just showed graphs for Nueces County. For the other counties in the Coastal Bend area, you can see this pattern very recently of these big increases. We think that this is the result of data drops that have come from the state, not unlike the ones that we've experienced in Nueces. I think that some other counties in the Coastal Bend area are experiencing those now. And you can see that in the previous graph with this jump up in the number of cases on one day. So we think that's coinciding with a data drop that occurred for some of the other counties. We don't think that this is actually an increase in the amount of COVID cases in the Coastal Bend area. So in general, we don't like to see the lines go up like this, but hopefully the data drops are the primary reason for that. Looking at the percent positive tests, we have two sources that we look at for percent positives because these are the only two sources where we know how many people tested negative as well as how many people tested positive. We know how many people tested positive for all the data sources. But we don't always get the number of negative tests, which would allow us to calculate a proper proportion. So for the mobile testing stations that are run by the National Guard in the state, the percent positives are around 24% right now. And for the local public health department, the percent positives have dropped all the way down to 4.5%. That's encouraging that they're so low. And while I'm not going to show the number of tests that are being done per day, they've been level for the public health department. So this is not reflective of a decline or an increase in the amount of testing. The testing has been similar over this period of time. moving forward. In terms of our rankings for hospitalizations, we have the fourth most hospitalizations per capita on average over the past week in the state. And by we, I mean the Coastal Bend, again, compared against all the other trauma service areas. It's not important that you read all these names. What's important is that you see where we fall within the rest of the state. And so we're still pretty high, and we want to see this continue to drop. The projected number of inpatients in the Coastal Bend area, our model remains parameterized the same for an unprecedented amount of time at this point. It's been at least a month and a half that we've been running with these same settings, and it seems to continue to be predicting the hospitalizations fairly accurately. Each one of these points is the total number of people that are in the hospital in the Coastal Bend on any one day. If you're in the hospital for 2 days in a row, you'll get counted on one day and the other day. So you can get counted twice, but only once in one day. And we project this forward about 2 weeks, and we expect to continue to see a slow decline in the total number of hospitalizations. When we take a look at the ICU, this is where our main concern lies, because this is where the hospitals in the Coastal Bend area operate on the lowest margin, if you will. Intensive care units cost a lot of money. It's a very special care. And so there's not as many extra beds in the ICU as there are in other parts of the hospital with the general beds. We've seen a precipitous decline in the ICU COVID cases over the past month and a half at this point. And so that's continued positive development, with right now 52 people in the Coastal Bend with COVID-19 in the ICU, 129 in the ICU that don't have COVID, for a total of 181 people in the ICU in the Coastal Bend. Now, this 181 people in the ICU, it's more than normal. This blue line that I drew across here shows you more like what normal is, and we're defining that based upon what was happening back in May, where you can see that there were very few people with COVID. Most people in the ICU were there for other reasons. And so that's why we define this line as where the average operating level of the ICUs are in the Coastal Bend area. And you can see that we're well above that average operating area. So COVID patients are taking up space in the ICU and affecting care. We need our frontline workers to work more to be able to handle all the patients that are there. And even though we've been declining for well over a month and a half, there's still a large number of people that are needing ICU care in the Coastal Bend area. So we want to continue our vigilance with trying to stop the transmission of COVID-19 and really crush down this curve. For fatalities in the Coastal Bend, we're ranked 4th in terms of the average number of fatalities per day. This number for us is going down, but when comparing to other places in Texas, we continue to rank fairly highly, and we don't want to rank highly. The reason why this says August 29th is that the way the fatalities are counted now, we don't really get a good number until 2 weeks after a particular date. So right now, we're going back to 8/29, and then for the 7 days prior to that is where this data comes from. Now, the reason why that's happening is the DSHS protocol is that they count the number of death certificates where somebody has the primary cause of death being COVID-19, and it takes about 2 weeks before all those death certificates get processed. This is what the accumulation of the fatalities looks like in the Coastal Bend area. We're up to 511 fatalities, substantially higher than the number just for Nueces County, and that's because Nueces County has a little bit over half of all the people in the Coastal Bend, and there's still a few 100,000 people outside of Nueces County in the Coastal Bend. We've had a fair number of fatalities there also. Again, this data is from death certificate data being counted by the state in the past 14 days. This leveling off doesn't necessarily represent a decline in fatalities as much as the fact that the death certificates haven't been counted yet. Now, that being said, we have had a decline in fatalities in the Coastal Bend area. This graph shows the data points, which are the actual number of fatalities per day in the coastal Bend area, where we got above 15 on a few days, which is way higher than we want to be seeing. And then for about the past month, at least from the beginning of August, there's been a slow and steady decline in the number of fatalities in the coastal Bend area. This blue area over here is for the past 2 weeks, where again, these death certificates are still being counted, and thus these triangular points we expect to increase above where they are right now as that data becomes enumerated. And so we hope that this downward trend continues, and I kind of think I see in the data an even more severe downward trend than is predicted by the model, but we'll have to see if that comes to fruition or if that's just because we're a little behind on counting the number of fatalities from the death certificates. Moving on to the cell phone data. And the reason why looking at cell phones is informative is because with COVID, we're kind of behind the curve the whole time. By the time we know that somebody tests positive, they may have already been exposed to COVID or been exposed to COVID 2 weeks ago, or at least a week ago. And that's when we become aware that somebody had COVID. Then a little bit after that, they might go to the hospital for some people. And as we just saw, some people end up dying, and that takes even more time. And so what the cell phone data allows us to see is what are we doing right now that might affect our probability of getting infected. And so one thing we've been tracking is visits to the coastal Bend from outside of the coastal Bend, potentially moving COVID among different areas in Texas and bringing it here to the coastal Bend area. This week we estimate that there have been about 50,000 visits to coastal Bend restaurants. And that's not 50,000 people, it's 50,000 visits. So if you go to breakfast, lunch, and dinner at a restaurant, that's 3 visits. And this metric has been slowly declining, and as the summer ends, we expect that it will decline more as our tourist season ends. And so there's fewer people coming to coastal Bend restaurants from outside the coastal Bend area right now. When we look at essential versus non-essential gatherings, with the essential gatherings in blue and the non-essential gatherings in brown tones, you see that everything except for movies is declining. These gaming areas, which spiked earlier in August, are now declining in terms of the amount of activity that's occurring there. Home improvement stores are declining, malls, restaurants, bars. Foot traffic at these types of businesses seems to be declining across the board, with the exception of movies, which notably opened recently, and we're seeing an increased amount of movie traffic, although not an alarming amount right now. A pleasant surprise has been the decline in the encounter index. And so the encounter index is something that we use to look at the probability that 2 people might come in so close contact that they're within 6 feet of each other. 100 represents the average normal amount, and that's before the pandemic started. The lines show you the different Open Texas phases. We're in Open Texas, what I call 1.5 at this point. And pretty much the way that I see it is that something's happened near the end of August where these numbers have started to decline. I suspect that it could be remote schooling that began around that time. It may also be the decline in travel that occurred with the hurricane that came by recently and hit Louisiana, as well as the end of the summer. So we're not sure 100% why, but we're happy that these values are declining, indicating that hopefully the transmission rate is declining. For schools, and this is something we've been watching, university foot traffic continues to increase. It's not quite to 50% yet, but it's maybe around 40%, high 30s, low 40% of normal in terms of foot traffic at the universities. This includes more than just TAMU CC. It also includes TAMU Kingsville and UTMSI. And I believe there's maybe one additional university that's included in there also. K through 12 foot traffic has leveled off, and junior college foot traffic is slowly increasing. and that would include Del Mar. So overall, the amount of foot traffic and cell phone metrics are looking, not too bad right now. So overall, it's important to remember that this Texas-wide outbreak isn't over. We just had Labor Day weekend, and hopefully we won't see a Labor Day weekend bump. It's certainly not time now to relax on your vigilance with restricting your transmission or potential contraction of COVID-19. I think it's important to remember again that we don't expect to see the effects of Labor Day, if there are any, for maybe 2 weeks, at least a week to a week and a half from now. And with Memorial Day, it took a little bit over 2 weeks before we really started to see that maybe there was a Memorial Day bump. And we know how that turned out. COVID-19 cases, on the good side, they're declining in the coastal bend. ICU usage is declining. Fatalities are declining. The ICU is still stretched, however, so it's important to remember that it's not time to go back to normal. The return to remote schooling seems to be correlated with a decline in cell phone encounters, even though that there's some more face-to-face schooling that's occurring with K through 12 students. Starting this week, it's my understanding that they're not going back to 100% capacity, and we expect that maybe there'll be a continued benefit of this remote schooling, which the idea would be that if the kids have to be at home, then the parents have to be at home too, and that's decreasing the amount of encounters and transmission. Lastly, our estimated transmission rate, somewhere between 0.9 and 1.0. Even though this is looking good and we're declining, it's not time to let off the gas yet. The amount of cases was much less before Memorial Day. And even so, with that much lower amount of COVID in the community, we still went through this huge explosion of COVID. And that's possible to happen again if we go back to open Texas phase 3 types of behaviors. So it's important to remember that. And that's a report. We'll go to the translation and then take some questions.
Actualmente continúan vigentes las intervenciones no farmacéuticas para evitar el contagio del virus, entre estas quedarse en casa si es posible, distanciamiento social y autoaislamiento cuando presente síntomas, entre otros. De acuerdo a las últimas cifras de casos positivos, el radio de transmisión del virus es de menos de una persona a una persona, o sea que una persona infectada potencialmente puede infectar a otra más. Este número bajo es buena noticia, ya que la transmisión pudiera extinguirse pronto. El área de la costa, la cual cuenta con 12 condados, continúa siendo la tercera área en el estado con el mayor número de casos per cápita. En cuanto a casos confirmados positivos en el área de la costa, es de 22.240, con 19.590 recuperaciones y 2.139 casos activos. El virus continúa recediendo. El pronóstico en cuanto a hospitalizaciones también continúa declinando, aunque los casos en las unidades de cuidados intensivos aún están por arriba de lo normal. En el área de la costa se reportan 511 muertes, fallecimientos que ya cuentan con un acta de defunción. Algunos casos pudieran tardar hasta 14 días en ser reportados a nivel estatal. Resumiendo, el virus en el estado continúa reportándose. Los casos en el área de la costa van declinando. Las muertes también van declinando, pero los casos en cuidados intensivos aún son muchos. El regreso a clases virtuales puede ser la razón de menos encuentros entre personas. El radio de transmisión es de menos de una persona, pero no baje la guardia. Aún no es tiempo de dejar todas las medidas de salubridad.
Okay, Dr. Davey Edwards, do we have any questions from Facebook Live?
One that just came in would be a good question to ask. Was the public traffic in the coastal bend greater during Memorial Day or Labor Day?
It was greater on Memorial Day in terms of the visits to well, actually, let me back that up. We don't have the Memorial Day data yet, but for the most recent data that we have, Memorial Day had much more traffic, but with the cell phone data, it remains to be seen. I don't know if Annette there knows anything more. Or Mayor McComb.
Yeah, we can let them answer if they want to. So another question is how the numbers drop so dramatically, so quickly. Is there any speculation of why? Could it be masks?
Yeah, it's all the things that we're doing, and I wouldn't call it a quick dramatic drop. You can look at the data, and it's been going down very slowly. We've been going down since the beginning of August, and it's now September, and we still have plenty of room to go down. Certainly, wearing masks is important. There may be some effect of a certain proportion of people may not get COVID because they've already had it at this point. I think people are being more cognizant of social distancing also, and we've seen a decline in the encounter rate. We've also seen, at least for a little while, decline in the number of people leaving home, although that's increasing slightly now. So there's a variety of factors that are contributing. We're also seeing now a decline in the amount of travel that people are doing, not only to the coastal bend, but outside of the coastal bend, which could also decrease the chances of contracting COVID.
Can you or Annette talk about the related comorbidities, related deaths or risks?
I feel comfortable deferring to Annette if she's there.
I'm here, Dr. Bird. What was the question? Do you mind repeating it?
Yeah, can you talk a little bit about the related comorbidity, related deaths and risks?
Yes, so we still see that the larger population that actually end up dying from this virus are those that have those comorbidities. And so we look at individuals with diabetes, individuals with kidney disease. Those seem to be the two highest comorbidities that we're seeing in Nueces County that are actually affecting our fatalities. But there are other comorbidities. Somebody asked me if being over the age of 65 was a comorbidity. While it's not a comorbidity, it's still, we do see that if you're over the age of 65, the probability of you having a worse effect from COVID-19 virus is absolutely there with age.
Backing up to the question a while ago was the amount of traffic more, are you seeing it more from your side as far as the data that we get? We're a little behind in getting that data for Labor Day.
So we don't have a lot of the data right now from Labor Day, so but we will soon. And we're looking at 7 to 8 days. So we're looking at next weekend into Monday to see if these numbers change dramatically. So we're in the double digits now, which is a really good place to be, and we want to get lower into the single digits, or zeros would be even the best scenario before flu season. But people do need to be vigilant about if they were with other people over this Labor Day weekend, that they need to be monitoring themselves, especially those that are going back to school, because there's no reason for you to go back to school if you feel like you may have had an exposure to COVID-19 over the Labor Day holiday.
Okay. So how long can, and this is a question for both of y'all, how long can symptoms like fatigue last after contracting the virus?
Well, that's a great question, but it just depends. It's a novel virus, and so some people have it for one day. They have symptoms, and then the other 9 days they're fine. They have no symptoms at all. They have no fever. So by day 11, they're already considered well, if you will. They're able to go back into the community, and they're considered completely recovered. But there's other individuals that are on day 11, on day 14, on day 27, that they're still struggling to breathe. They're still having fevers off and on. They're still having chills. So it really just depends. That's not the majority. That is the minority. And so for recovery, for hospitalizations, CDC's new guidelines basically says that it's 20 days if you've been hospitalized, it's not the 10 days, because they know that those individuals have had a much harder time with the virus, and it takes them that much longer for them to actually recover.
Okay, and that's it for the questions. The Facebook audience wanted to give you thanks, Chris, for your time and also during the time that you're having to fight off the virus.
Thank you very much.
Okay. So that concludes our press briefing today. So thank you for being here. We appreciate you. So we'll see y'all on Thursday. Thank you.